left hip. Okay, so I'm gonna walk in. The most important thing for me, of course, is to make sure that my patient is alive, right? That's the first thing. So how do I find out? I do vitals, blood pressure, all that good stuff. I verify that my patient is alive. The next thing I want to find out is, are they okay in the head? Can they follow my instructions? I'm going to ask some very basic questions. Hey, my name is Ifam. I'm a physical therapist. I'm working with you today. Tell me, what's your name?
Cassidy.
Cassidy, okay. And as I'm doing that, I'm checking Cassidy's name tag on the wrist, just to make sure that it is Cassidy. Tell me what your date of birth is.
6/11.
And Cassidy should know what her date of birth is. So at least we've kind of cleared some of that stuff right there. So the next thing I need to do while the patient is still laying in bed is I want to make sure that they can do the things that are important for a patient that's in bed. Pressure relief and being able to move around in bed. We know that there's no restrictions on this leg here, so can I have you bend this knee at all? I can have my patient do that themselves, right? Can you move this leg at all? Now, I know that because my patient has an anterolateral approach, we don't have any problems with hip flexion past 90, right? Our most significant thing is hip extension, which is very difficult for any patient to do. So, can you move this leg at all? Oh, that's so painful. Okay, good. Go ahead and relax. That's not a problem at all. You don't need to do that. Now, what I want you to do with just this leg alone, and I can go and do some strength training and some just assessment of strength here. Go ahead and hold that right there. Don't let me push down. Okay, again, this is all gross. You're not like trying to break anything here, right? Go ahead and bend that knee a little bit and hold it right there. Don't let me. I'm just trying to make sure that this patient can actually hold themselves with this leg because this is the only one that's going to be holding them up, right? Go ahead and relax. Let me have you bring your foot towards you. Hold it right there. Don't let me pull. Okay, great. Push into my hand. Excellent. While they're still here, I can do a neuro test right here. Can you feel this?
Mm-hmm.
Same on both sides?
Yep.
Okay?
Yep.
Let me know if there's any difference. Spread your fingers out for me. Okay? Can you do this? Back and forth? Okay, great. Now go ahead and spread your fingers all the way out. Don't let me pull them in. Excellent. Okay, put them all together. Don't let me pull them out. Right? Okay. Excellent. So now I feel that my patient is okay with all this stuff. The next thing I'm going to ask my patient, did they tell you anything about your hip precautions and all things that you cannot do?
I think I can't bring it back. That's about it.
Okay, good. I'll just review those with you and I'll leave a little piece of paper for you to kind of review those as well. We'll go through that tomorrow when I come back, okay?
Okay.
But in the meantime, I want to show you how to get out of bed. Now tell me at home, is your bed about this high or is it a little lower or higher than this?
We'll just say it's
About the same height. Okay, great. So now I'm going to decide how I'm going to get my patient out of bed. There are two ways to do this. One is a flat spin. A flat spin is basically me saying that I'm going to move everything at once while my patient is holding on to me, and we're going to get the patient over to the other side. The other way is to get my patient to go out to the side. Now, this is where it becomes a little interesting, right? Can my patient abduct the leg?
Yeah.
They can, right? All right. So now they can't do it themselves probably because of pain, but can they use this leg to abduct? They probably could, right? Because I want them to go home. That's the big thing here. I want them to be able to do all these things by themselves. The distance between the injured limb and the edge of the bed is shorter here, because you only have this much to go, than it is from here to here. So my clinical reasoning is if I teach my patient to go out this way, it's going to be more painful because they have to go really, excursion of the distance from here all the way out here is going to cause pain, right? So I'm going to teach you how to do it on the other side.
Okay.
In the meantime, let's find out at home, do you come out on this side or this side of the bed?
Normally this one.
Normally this side of the bed. Is there any problems or anything that would restrict you from coming out on the other side? The reason why I'm asking is because it's much shorter distance for you to go out on this side. Is that possible at home? Okay. All right, great. I'm going to show you how to do it on this side. So here's what I want you to do. I want you to move your legs over this way. Now remember, this is a question that you guys are asking a lot of, right? If my patient log rolls to this side, because they have an incision on this, that's going to hurt like crazy, right? If you log roll them on the other side, you would have to put something between their legs, again, to mitigate the pain. But if I can teach my patient how to push this leg just a little bit at a time, there we go, good. And then I want you to just kind of hold on to me right here and keep moving that leg over, and then here we go. And then go ahead and sit up. Wonderful. As soon as my patient sits up, I'm going to hold on to my patient. The things that I'm concerned about is I have a side rail that's up on the other side. If my patient's balance goes out, she's going to fall backwards and hit her head on that side rail. I want somebody to take care of that so that she doesn't fall, right? But at the same time, this gives my patient reassurance that I'm here, right? Okay, I'm gonna have you just kind of put your hand over here and let's lower this bed. This is where the body mechanics thing happens, right? The reason why the bed was high initially was from my own body mechanics. Now I'm more concerned about the patient's ability to actually sit, put her feet on the floor so that her balance is significantly advantaged at this point. All right, now with you sitting like this, I want you to kind of try scoot forward. Let's put your feet flat on the ground. Okay, how are you feeling right now?
Great.
Good. This is the time for me to, again, assess vitals. Do we have any dizziness or lightheadedness while you're sitting here? And you notice that my hand is still on my patient. I can feel a lot of things here going on. If my patient starts going this way, they start going out this way or whatever, I've got my patient. All right, then from this point, my vitals are good, everything is all right. Now we can start doing all the outcome measures that we can do from here. Let me have you try to scoot over towards me. Okay, excellent. Let's have you scoot over the other way. Beautiful. What's your pain level here, 0 to 10? 3. Okay, that's good. You must have gotten the good meds, right? Okay, excellent. So now I'm going to teach you how to stand up. The first thing I'm going to do is I'm going to put this gait belt on, wrap it around. And this is just for me to know where you are. It's not really going to prevent you from falling. You're not going to fall here today because I've been doing this for a long time. So do you have any questions for me at all at this point? Okay. So at home, do you use a walker, a cane, or anything at all before you came to the hospital?
No.
No, nothing at all, right?
No.
So that's going to be the goal. Eventually, we're going to try to get you back to walking without a walker or a cane. But I won't be able to do that here in the hospital. But when you get discharged, you're probably going to go to an outpatient clinic and they'll work on all those things. Okay. All right. Excellent. So now I want you. This is the standing up part. I'm going to show you how to do this. The best way to do this is you're going to scoot forward a little bit. Okay. There we go. Excellent. And what I want you to do is I want you to lean forward. You're going to tuck your legs in just a little bit. There we go. Beautiful. I have my hand on the gate belt, and I want you to look up just a tad, and then I want you to lean forward and then push with your good leg, and up you come. Excellent. And in the meantime, I have a walker that's sitting over here, and that's just for support, right? But I don't want my patient to use the walker yet. I'm just holding on to them right now. Okay, how do you feel right now? Everything is good. Okay, now let me have you hold on to the walker. Okay, wonderful. Then from here, I can actually ask my patient what I typically ask my patients. I want you to scoot just 2 steps up towards the head of the bed. 1, 2, very good. Let me have you scoot the other way. 1 and 2. Now, some of you might call this a 4-stage balance. And now I want you to go forward and back. So the reason why I do this is for safety. If my patient is able to do these maneuvers, back and forth and forward and back, it tells me that this patient is most likely going to be safe. If I get them to the edge of the bed and they're slightly down towards the foot of the bed, I can actually have them adjust that. And they can take a step away from the bed without falling. Because if I just get them to walk without testing this, if they took 4 or 5 steps away from the bed and the bed is now like, a mile behind them, something happens, they're gonna fall and I won't be able to recover that, right? So this is kind of my little assessment. And then while I'm here, of course, I can have them just put their feet together, all that good stuff. Okay, with your feet apart, I'm gonna have you just give me a high five right up here. Excellent, good job. High five with the other hand. There we go, excellent. How about down here? Beautiful, excellent. I'm just trying to challenge them outside of the patient support. All right, now we're good. The next thing that I'm going to have you do is let me have you transfer to a wheelchair or have you transfer to a chair. I show them how to transfer to a chair. Again, the same thing. I want you to just kind of walk your way around, and then you're going to look up, reach back, and I want you to sit down. Right? So that's kind of your initial assessment, really, when you're looking at it. It's very quick stuff. If your patient is sitting down, I have you sit down. While they're sitting down, because you just heard your patient say that they live alone at home, so you're gonna assume that they comb their hair, they eat. There's all kinds of things that they do. They're gonna need to reach for stuff. They tell you that they have hobbies. What are your hobbies? I knit. Oh, okay. So let me see if you can reach over here. Excellent. How about across your body over this way with the same hand? Okay, beautiful. So I'm getting an idea of what they're able to do while they're sitting, and then when they stand up, I'm gonna do the same thing. Try to figure out if they can do if they can reach, and how much they can do. And that's going to tell me whether they need to get home health services when they get home, or if they need to go to outpatient clinic right away. Questions? So in essence, it really doesn't take a very long time. You should be able to kind of buzz through it pretty quickly. The most important thing in an outpatient clinic, in acute care, is you need to assess your patient's ability to sit, stand, walk, and transfer as soon as you possibly can. And remember that your nurse is a caregiver for the patient for the next 23 hours. You need to give them clear instructions on what this patient is able to do. So when we get done, the nurse is going to ask the PT and say, hey, what's the story with 225? That's the room of the patient, right? And my answer will be, well, patient is able to sit on the edge of the bed independently. You guys don't have to do anything at all, but they'll need a little bit of help just to get to the edge of the bed. Pain was the biggest problem, but cognitively she's good. She was able to tell me all the precautions. Standing was a little tough for her, but once she's standing, she can walk. She was able to walk 200 feet from me, so it's safe for you to walk with the patient around the unit. Just make sure that she takes about 3 or 4 rests while she's doing that. So you've just told the caregiver what instructions you want them to do, because when you come back the following day and your patient has walked, say, 4 or 5 or 6 times, that means I don't have to worry about walking anymore as a thing that I need to do with my patient. I can start concentrating on the stairs, which you told me you have at home. So you're now using your team, the nursing team, as kind of your helping hand for the things that you want them to do. The same way I would go to a family member and say, Mom or Dad is now safe to walk at home. What I want you to do is every day, 3 times a day, get up with Mom, and I want you to walk at least 3 or 4 times, 200 or 300 feet, because Mom needs to get a little stronger. That makes sense? So your nurse is anticipating to know what is safe to do with this patient. But as far as the bathroom goes, she did not do very well. She was very unsteady. I would just wait on that and have her use the bedpan until we come in next week, until we come in tomorrow to train her on how to use the bathroom. That makes sense? So that's really kind of what you're trying to do on your SBAR when you leave. When you come in, you're trying to get an understanding of what has been going on with the patient since the last note that was written. So the last note said that the patient was alert and oriented, everything was fine, she was, eating lunch or whatever the case is. But between that note and now, the nurse knows that the patient has called in a couple of times, she was in a lot of pain, she's having a hard time breathing. That's the most current information. That's the reason why we go talk to the nurse. Tell me what's going on with room 223. Oh, she was doing really good this morning, but my gosh, she got knocked out when we gave her morphine, and she hasn't woken up in like 20 minutes. Can you guys try and wake her up and tell us what's going on? Okay, fine. So at least now I have the most current information. But in my note, I'm going to state that nurse reported that the patient has been lethargic since this morning. Tried to arouse the patient. She was unable to wake up. So that's why I'm going to defer the treatment until tomorrow. Questions?